How many grafts do I need? I was wondering how many grafts I need. I have been told anywhere from 1,200 to 3,000 from various doctors. Thank you.
Thank you for your question. You've submitted several photos and you're asking how many grafts would you need? Well, certainly that's a very typical question that people ask all the time because when you look for solutions for hair loss, invariably you learn about the option of hair transplant surgery and all the things that hair transplant surgery is supposed to be able to deliver. And it is common to speak in terms of grafts. So what I'm going to do for you is walk you through the steps that we use in our practice to determine the best solution for someone like yourself. And if you are asking about grafts, I think you'll be surprised to learn that there is another alternative that we've developed in our practice that can probably help someone like yourself with this situation. So what do we need to learn first? First, we need to know the age of onset. You look very young in these photos, so we want to know how old were you when you first started losing hair. Then we'd ask, of course, about family history. Typically what you appear to have is male pattern hair loss. So we look for whether there are uncles or cousins and siblings who have similar pattern till we can get an idea of what the rate of progression is. Hair loss is not a single event. It is a process of hair thinning, eventually leading to hair loss. A very important factor to think about when you're thinking about surgical hair restoration. Then we'd ask about medications that you're currently taking. In the United States, there are 2 FDA-approved drugs for hair loss in men. One is Finasteride, which is a pill you take daily. Finasteride works by inhibiting an enzyme called 5-alpha reductase. This is the enzyme that converts testosterone to dihydrotestosterone. Dihydrotestosterone is responsible for causing thinning to dihydrotestosterone or DHT-sensitive hair follicles. The idea is if you diminish the DHT, you diminish the triggering factor that causes hair to thin. Minoxidil is the other drug that is used topically that appears to prolong the growth cycle, which actually gets shorter when hair is thinning so that there appears to be more hair on the scalp. Currently, there is a lot of concern about finasteride, and many people, particularly younger men as well as men in the Middle Ages who are in their 30s, 40s, 50s, will not take finasteride because of fear of long-term sexual side effects. So that leads everyone to conclude that they need hair transplantation. But let's learn some things about hair transplantation that is very often underplayed because hair transplant, when you get down to it, is very much a business. First of all, you don't stop losing hair, especially if you're not going to be able to take a medication like finasteride. What does that mean? Regardless of the number of grafts that are placed, you'll continue to lose hair. That's fact number 1. Fact number 2 is you only have a limited area to transplant hair from. Currently, it's very popular to look at follicular unit extractions as, quote, scarless surgery. But why is it scarless? Well, in order to do follicular unit extraction, you have to go way outside of the true donor area or the genetically resistant area where hair is taken from for hair transplant. When you look at that band of hair that remains, that's the hair that is truly genetically resistant. Regardless of the number of grafts that is estimated that you'll need, in order to achieve density, you typically need at least 2 transplants, especially in the temporal peak areas. Because what you're looking at is a lot of area of bare scalp. And when you're looking at bare scalp, you think of the density that a natural hairline has. And what does that mean? Density doesn't only mean a line, but also the hairs behind that line. So essentially, you have to crowd the hairs in layers so that you can actually have the impact of having density. What happens typically with a hair transplant is that even with as close as possible the hairs are placed together, a certain amount of hairs will not survive, and invariably you'll need more than one transplant to fill in those corners to get the volume that you want in the face of progressing of hair loss. So you can imagine there is a reason why more than 65% of people having hair transplant, according to the International Society of Hair Restoration Surgery, are not satisfied or desire more density after hair transplant. In our practice, we have developed a method of restoring hair in a way that is actually non-surgical and can appear to be too good to be true, but actually is not. The concept is that hair that is thinning is going through this progressive hair loss until the point of hair loss, but with the microscope we can see a lot of potential hair. What we are doing is we're using extracellular matrix that was originally used for wound healing, combined with platelet-rich plasma, which is derived from your own blood, through a formulation and a method of technique of delivery to actually treat the thinning hair. And that results in reversal of hair thinning, and the hair starts to become thicker. We have hundreds of patients to prove the validity of this procedure. We have been able to also demonstrate by simply looking critically at the numbers that for the majority of patients who come in early enough in their hair thinning process, that the volume correction that we get far and away exceeds the results of almost any hair transplant. And I would challenge any hair transplant doctor to take the same patient and match them appropriately and compare the results with doing a transplant compared to hair regeneration. Now that means that particularly for younger people, without surgery, they can have an injection that results in significant correction of volume and area of coverage and halting of the hair thinning progression. We have patients who come from all over the world, and we have tremendous data to support its benefit. And so when someone like you comes to our practice and wants to discuss the number of grafts, then what we would do is essentially look at the area of hair loss and estimate for you the number of grafts that you would need and what the area of hair that's readily available would be necessary to fulfill that requirement. But before doing the surgery, I would actually insist that you do the hair regeneration procedure so that you would actually benefit from the reversal of hair thinning and thickening of the existing hairs so that you would actually get the volume of hair that you would otherwise have needed to be grafted. And then at the end of 18 months, which is our typical time frame, because people can respond as early as 1 month, but it can take as long as 18 months to get the full benefit, we would then reassess. And if you wanted more hair, then we can be more secure in the strategy of doing a transplant because we know that your progression of hair loss would not be continuing. And we would be able to be more strategic in the way we're able to place the hairs, because we're actually dealing with a limited number of hairs in the donor area, but when you have less scalp to cover, you can actually be able to place more hairs in a more dense way and get the results that you're looking for. So, as I said, the typical approach we would have would go through understanding what your limitations are and avoiding just going for the surgery, because you would end up having a short-term benefit, but in the long term, with progressive thinning, you'd only have the hair grafts left. And that's why so many people are dissatisfied with hair transplant, and why so many people are then forced to continue getting hair transplant. So in our practice, hair regeneration has become the treatment of choice for people who are thinning and have existing hair before moving on to hair transplant. But I can tell you that more than 90% of our patients, once they have hair regeneration, they don't feel that they need a hair transplant. And again, that is contingent upon how much hair they have existing. So with that being said, you now have more information to help guide you as to what would be the best choice for you, besides shopping for the best doctor for the number of grafts you're looking to transplant. So I hope that was helpful. I wish you the best of luck, and thank you for your question.